The next informational video concerning strangles will be related to testing for strangles. Since strangles is such a contagious problem in the horse, testing can be really important to help determine the cause of disease initially when problems first arise, and also to help us determine when a horse is free of the disease and can be reintroduced to the normal population. Since the initial signs of strangles, which include fever and nasal discharge, are very similar to other causes of respiratory disease in the horse, it's important to get your veterinarian involved early in the disease process so you can make the best decisions about what's causing the disease and how best to manage the horse going forward. In the case of strangles, our best testing option is to do what we consider or call an upper respiratory tract scope. So that uses a flexible endoscope, which is basically a camera that passes up through their nose and allows us to look at the nasal passages, the throat region, and a specific area called the guttural pouch, which is unique to horses. This is basically an outpouching of the inner ear canal, but it is in close proximity to some lymph nodes, so it's very common for bacteria, in the case of a strangles infection, to end up in those pouches. The bacteria can hide out in those pouches. It can cause chronic infection or allow the horse to be what we almost think of as a silent carrier, where the horse looks healthy, looks like they got over strangles, but they continue to shed the bacteria periodically and act as a source of infection to other horses. Once you scope the upper airway and make sure all of those areas are clean, then you actually infuse some fluids up through the guttural pouches, and that also flushes out through the throat and the nasal passages, and collect that fluid to do testing. The best testing option is called a PCR test, which looks for the DNA of the bacteria. This is a more sensitive test than strictly a culture, which is looking for a bacteria that's able to grow. A negative or clean scope and a negative PCR test then makes you feel comfortable that that horse no longer has strangles and that they can rejoin the general population.